Addiction, a word that carries with it a multitude of emotions, judgments, and misconceptions. But what lies beneath this complex human experience? To truly understand addiction, we must delve into the depths of the human psyche. Today, we explore the perspectives of two influential figures, Carl Jung, the Swiss psychiatrist and founder of analytical psychology, and Dr. Gabor Maté, a Canadian physician renowned for his work on addiction and trauma. Through their lenses, we aim to uncover the psychological underpinnings of addiction and the pathways toward healing. Understanding addiction is often perceived as a mere dependence on substances or behaviors. However, this view is limited. Addiction is a multifaceted condition that intertwines biological, psychological, and social factors. Specialist 1, it's not just about the substance. It's about what the individual is trying to escape or cope with. Specialist 2, addiction is a complex interplay of genetics, environment, and personal history. To gain a deeper understanding, we turn to the insights of Carl Jung and Dr. Gabor Maté. Carl Jung's perspective on addiction. Carl Jung viewed addiction as a manifestation of the individual's quest for meaning and wholeness. He believed that the use of substances or behaviors was an attempt to fill an inner void or to escape from unresolved conflicts. Addiction is the equivalent, on a low level, of the spiritual thirst of our being for wholeness. Jungada.org Expert 1, Jung saw addiction as a symptom of a deeper existential crisis, a search for the numinous, or a spiritual experience associated with the divine. He suggested that individuals turn to substances or behaviors to experience a sense of the numinous, a term he used to describe profound spiritual experiences. However, these attempts are often fleeting and ultimately unfulfilling. Expert 2, Jung believed that true healing comes from confronting the unconscious and integrating its contents, rather than seeking external substitutes. Dr. Gabor Maté's insights on addiction. Dr. Gabor Maté approaches addiction through the lens of trauma and early childhood experiences. He posits that addiction is a response to emotional pain and unmet needs. Addiction is not a choice. It's a response to trauma, stress, and unmet needs. In his book In the Realm of Hungry Ghosts, Dr. Maté explores how early life experiences, including trauma and stress, can predispose individuals to addictive behaviors. All addictions are attempts to escape the deep pain of the hurt child, attempts temporarily soothing but ultimately futile. Dragabermate.com Expert 3, Dr. Maté emphasizes the importance of understanding the root causes of addiction, which often lie in early childhood experiences and the body's stress response mechanisms. He advocates for compassionate inquiry and trauma-informed care as essential components of effective addiction treatment. The intersection of Jung and Maté's theories. While Jung and Dr. Maté come from different backgrounds, their theories converge on several key points. Expert 4, both recognize the profound impact of early life experiences on the development of addictive behaviors. Expert 5, they agree that addiction is a coping mechanism, a way to manage unresolved psychological pain. Integrating their insights offers a holistic approach to understanding and treating addiction, emphasizing the need to address both the conscious and unconscious aspects of the individual. Pathways to healing. Healing from addiction requires a multifaceted approach. Expert 6, therapies that explore unconscious motivations, such as Jungian analysis, can help individuals understand the deeper reasons behind their addictive behaviors. Expert 7, trauma-informed care, as advocated by Dr. Maté, focuses on creating safe spaces for individuals to process and heal from past traumas. Combining these approaches can lead to a more comprehensive and compassionate treatment plan. Case studies and real-life applications. 1. Understanding my past and the trauma I experienced helped me see why I turned to substances. 1. 2. Integrating mindfulness and self-awareness practices has been crucial in my recovery journey. These personal stories highlight the transformative power of combining psychological insights with compassionate care. Addiction is a complex and multifaceted condition. By exploring the perspectives of Carl Jung and Dr. Gabor Maté, we gain a deeper understanding of its psychological roots and the pathways toward healing. Remember, the journey toward recovery is not a solitary one. Support, understanding, and compassion are key to overcoming the labyrinth of addiction.